Hi guys, so what is phishing in healthcare? Phishing is basically tricking people into handing over sensitive details by pretending to be someone else. Hackers love targeting healthcare because medical records are way more valuable than credit card info. They can be sold for hundreds to thousands of dollars in the dark web. With full files, criminals can commit identity theft, do insurance scams, or blackmail. Phishing often opens the door for bigger attacks like ransomware or data theft. A good example is the Medicare breach in 2023, and it cost the Australian government over $250 million. So now we'll cover the four main types of phishing seen by Vishal in his eHealth experience. So these are two examples of what it looks like when a healthcare provider is hacked. One is a real medical record redacted from the Nocona General Hospital. And the second is when, we'll cover this further in the later slides, when MediSecure got hacked. And this actually led to the shutdown of the entire company. And this was an ad put up on the dark web. Next slide. So here are the four types of phishing. Email phishing in healthcare often looks like fake lab reports or pathology results, and it comes with infected attachments. Another trick is sending links that appear to be updates to a patient's file but actually lead to credential theft or malware. And this is an example. It's quite obvious. If you're getting your medical information from a bit.ly link, it's best not to click on it. So this is the type of phishing that Vishal sees the most at eHealth, spear phishing. It's when a more focused version of phishing where attackers go after specific people like doctors, nurses, or IT professionals. They'll often include details such as staff rosters or patient names to make the message more legitimate and harder to find. And it's not too clear, but this is the National Center of Health Marketing, and he was sent to one of the directors. This is another popular phishing scam. It's when whaling targets. It's a big decision. It targets big decision makers like hospital executives or department heads. Attackers pretend to be these leaders to authorize fake invoices or payroll changes, which can easily add up to losses in the millions. And here's one from a banking company to a senior lead, Debbie. And then we have the one that you guys have most likely faced. This needs no further explanation, smishing and vishing. You guys probably have gotten Oz posts that, you have a delivery to pick up, or you have an e-toll payment that you missed, etc. And this is an example of a Medicare fraud, basically. So what's the financial and sector impact for wider Australia? Phishing and scams hit different parts of the healthcare system in different ways. Government services like MyGov and Medicare see refund scams that trick thousands of Australians into huge amounts from call center time, investigation and reimbursements. Hospitals in the private sector face ransomware that can delay surgeries and emergency care, while also damaging public trust. And things like smaller GP clinics are often hit with invoice scams or fake pathology requests, and for them, even losses in the hundreds of thousands can be devastating. The big picture is Australians lose up to $470 million in phishing scams just in 2023, with the average healthcare breach costing around $16 million. And these patient records remain incredibly valuable for hackers on the dark web, selling for hundreds to thousands of dollars. Next slide. So these are two breaches that we can talk about. One was Medibank and the other was MediSecure. So the Medibank breach exposed the data of 9.7 million customers, including highly sensitive health records, resulting in financial damage exceeding $125 million. And the MediSecure hack attacked 13 million Australians worldwide, and as mentioned before, the company collapsed immediately. Next slide. So these are the three main threat actors that Vishal sees at eHealth. The three main groups that stand out are ransomware affiliates, which use phishing as their entry point, then move to double or triple extortion, encrypting systems, stealing data, and sometimes even launching DDoS attacks to pile on pressure. BEC actors focus on invoice or payroll fraud by hijacking email threats or spoofing domains, often without any malware at all. And the last is state-sponsored APTs, aim for patient data or research IP using targeted spear phishing campaigns and built-in admin tools like PowerShell to quietly move around. And Vishal will go to the technical side of things.
Um, Thanks, Shadman. So, yeah, I'll just go through the meta attack framework. I'm sure you would have heard of it, but yeah, in detail. So, it's basically a global knowledge base of adversary behaviors that lets us map detections. It's a typical chain in terms of phishing, might be leading to script execution. So, using any PowerShell or command line C2C type behavior. And then they also use stolen credentials for persistence. And this is just a main high level overview of the chart. But if you're going through the details on the MITRE attack framework website, you could go through one each specifically and see it yourself. So basically, breaking any link collapses the kill chain, and blocking clicks through email gateways is really important, especially for macro policy purposes. And it's important, as you all are aware, MFA is really critical. And disabling IMAP POP, preventing scripts from executing, and alerting on exfiltration attempts is really critical in terms of preventing phishing attempts from happening. And I'll just go through the Essential 8 framework in a bit more detail. I'm sure as cybersecurity students, you would have all heard of it, or probably like heard of it somewhere or see this somewhere. But it's basically designed by Australian Cybersecurity Centre and partnered with ASD regarding preventing any phishing-led attacks, or even mitigating any common cyber threats, basically. So it's basically the eight essential controls measures. So application control, patch applications, configure office macros, user application hardening, restrict admin privileges, patch OS, MFA, and tested backups. So basically, together, we can use all these 8 mechanisms to mitigate any threats, avoid exploit windows, and reduce admin misuse, and make ransomware recoverable. Basically, this directly correlates with the techniques like T1078 through MITRE attack framework, which is basically for credential abuse. So yeah, Essential 8 is another important framework used to mitigate phishing threats. And in terms of maturity model, you might wonder what government organizations usually try to achieve. Like, there are different maturity levels, right? So you might wonder what exactly. In terms of government organizations, especially working at health sector, mostly we're in maturity level 2 right now, working towards maturity level 3. But across all government organizations, the minimum, it's required to achieve at least level 2 or level 3 to achieve that mandatory risk-based management requirements. And in terms of federal government sectors or non-corporate Commonwealth entities, according to the Policy Safety Protective Framework, which is another important critical cybersecurity framework, level 2 is where most agencies work towards at, whether it be private organizations. But yeah, this is one interesting technical side of things to be aware of in terms of phishing. And some example, I'm sure Shad would have shown you some basic level examples, but this is more like high level phishing campaign examples. So first one would be like the APO style, so it's basically ATO style. So a compromised supplier account sends the files to a large use secure link, which is a link that leads to a fake SSO single sign-on page that harvests credentials. So basically, they have hyperlinks it looks legitimate to you from sender such as Microsoft, but when you hover over the link, of course, you would have seen many emails similar to this that redirects through another SSO page. And then not only it redirects to another SSO page, another thing to note from this is that they usually gain access to your policies, and once a person clicks on that link, they usually have mail forwarding rules that automatically gets embedded to the system. So yeah, once a user clicks on it, they are more persistent to receive future threats similar to that email in the future. And next up, another one would be a moderate level one would be business email compromise invoice. So basically, many businesses in Australia, whether it be health sector working in or any government entities, one of the most common types of phishing emails we get is business email compromise, which basically any false, misleading invoices, fake fraudulent scripts, invoices, or any scam alerts, they send it through email, and then basically they threat hijack or lookalike domain requests with payment, like new bank details. They probably mislead you guys with a fake page and etc. The red flags to note in this is basically failed DKIM and DMARC, which I'll go through more further in detail. And basically, this is one example in terms of moderate business email compromise invoice. I know it's not that clear. I didn't zoom it properly, but I'll go through more detail specifically in terms of technical nitty-gritties. And just the easy one, like as Shad explained to you earlier, in terms of text messages, Medicare, you would have received many phishing alerts like that, so it's important to be aware of. And in terms of technical tools and defense mechanisms for all these phishing attempts, it involves using a layered approach, especially start at the edge with email gateways. So like use safe, make sure the links are safe, attachments are safe through URL detonation and business email compromise heuristics. So basically we enforce SPF DKIM DMARC with major, SPF basically stands for safe, it basically stands for sender policy framework, and domain DKIM stands for domain keys identified mail. DMARC stands for domain-based message authentication. So any email that's sent, it has to pass these three checks in order for the email to be safely sent to the recipient. And basically, another important aspect is on the identity and detection side, we use MFA, conditional access, and endpoint detection and response tools such as Microsoft Defender, and to monitor for any OAuth or authentication abuse or mass forwarding. So, and in terms of data and response, we apply DLP like procedures and rollback access control. Like previously in the previous presentation, you would have heard of the importance of the role-based access control. And this is really important in terms of blocking malicious domains, maintain tested backups, and based on Essential 8 requirements, these are all critical, important stuff that we all need to be aware of to protect data and build resilience. And just the SPF DKIM process explained in detail. So basically, SPF, I'll just goes through this. So sender sends the email. It goes to the DKIM signature. So sender receives the DKIM signature, and then the recipient email server checks the reputation, blacklists if it's malicious, and then checks the authentication of that specific sender email. And basically, if it goes to the DMARC policy, it passes through the SPF and DKIM checked. And if it's passed, for example, it would go through Defender, Microsoft Defender, DKIM policies, and then it would be either pass, block, or quarantine. I forgot to go through in detail, but basically in Defender, you could see some examples. So you can basically mark the email as no threats found, phishing, or junk based on your initial observations as a security operations center analyst. And also, in terms of alerts, you can also see the active user alerts through Microsoft Defender. So these are some industry tools that we use in government entities, especially for phishing. And it's important that it's good to be aware of, And so it's important, we all came to know about the issues in terms of phishing and some technical details, but it's in terms of education and awareness, so it's important that we do regular phishing stimulation campaigns to bring awareness to the specific staff. Ensure the metrics always matter, so how many percentage is phishing-prone emails, you need to keep track of the report rate, mean time to report, make sure all role-based access control and training are properly implemented to ensure it's all safe and secure. And make sure report phish button on Outlook. I tend to notice that many employees, especially in government entities, they just tend to click it straight away instead of like marking as junk or deleting that specific email from inbox. They straight away just press the report phish email button in their Outlook, but it probably triggers another existing alert to the backend server. So it's important to distinguish the differences between junk, spam, and report phish buttons in Outlook and educate the staff accordingly. And it's basically make sure to onboard all the requirements, keep track of key playbooks, triage tools, etc., and make sure everything is documented. So future staff, they could be also, if someone joins new to an organization, they can be well and aware of all the education and awareness procedures they need to go through to prevent phishing. And so that brings us to the end of our presentation. And then also, phishing is #1 initial access vector in terms of healthcare. Not even healthcare, any government sector or non-profit organization. And mainly, we can prevent this through tech, process, people. So these three layers are the most important and most significant. The first layer is tech. So using Microsoft Defender for Office and Perception Point, which is another email gateway to track phishing emails, and MDR, so Microsoft Defender for MDR, Microsoft Defender for Response, and then Basically, use MFA, instant response, and any security event management tools to prevent from further phishing alerts from triggering. And basically the process, so instant response process. So how do you, once an alert gets triggered, how do you contain the alert? How do you eradicate the alert from occurring in the future? Because if you don't eradicate and contain an alert, it'll keep triggering the same alerts in the future. So you need to ensure the triage process is properly implemented in the workforce setting environment. And yeah, you need to make sure to also have tested backups, because it's really critical end of the day to have backups of the environment. In case a phishing simulation or phishing attack actually goes through and person is actually compromised, you need a backup server with all the software tools, so you can straight away replace that software existing tool to make sure from existing software to being compromised from future attacks. And yeah, people, so ongoing trainings, education and awareness campaigns, phishing simulations, you have to regularly do that. And yeah, that's about it. That's how that's the importance of phishing. And so basically these 3 layers plus culture is equal to resilient cyber safe healthcare. And yeah, that's about it. Hope it makes sense. Thank you all.